Hey guys, I'm Fancy,
And I'm Colleen.
and you're watching the Good Wives Network. And tonight we are doing a special expose on the Gypsy Rose Blanchard's medical records and how we believe that a chromosome disorder can prove everything that happened in her life and that it was never medical child abuse.
Something big happens in early 2011. She sees a neurologist in Kansas City, which this neurologist finally gives a shit. Dr. Lepachon actually gave a shit and ordered a cytogenic and genetic test done on Miss Gypsy Rose Blanchard.
What you're hearing is a clip from the recording that Colleen and I did last night. Now, sadly, there was a little bit of technical difficulties, and so it didn't pick up both of us. It only picked up Colleen, and so it was hard for me to clip it for you guys today. So I'm going to take you through our notes. These are the notes that Colleen and I used last night. Of course, it's always going to be saved. Yep. So what I'm going to go through tonight in just about the most quick, easy, simple way of doing this. This has already been uploaded to our Patreon. You are going to get medical records tonight. Okay? They have been redacted. We have 3 different documents for you. And in those 3 documents, you will have over 250 pages of documents to look at. It is only 3 documents that we needed to show you what we have found. Okay. Yep. Someone actually gave a shit. Yep. That's what Colleen said. Somebody actually gave a shit and went and ordered a test in 2011 that proves exactly what Colleen and I are alleging. So with these 3 documents, and I've already shown you the actual results in the promo that we put out the other night. Okay. I showed you the main 3 pieces out of these 3 documents. So it's a 204-page document that Dr. Flasterstein and Dr. Steele both had. Dr. Steele requested the records from Louisiana on 9/23 of 2005. And then in 2007, Dr. Flasterstein re-requested again the Louisiana records, and they received a 204-page document that included Tulane Hospital and several others from Louisiana. Now, there are some questions that I would like to take real quick about how did we get this document? How do we have it? Did we obtain it legally? Is it a violation of HIPAA? It is absolutely not a violation of HIPAA for Colleen or any other professional that did not treat Gypsy to look at these files, as long as we received the files legally. I assure you, we did. I also assure you that I have proof that we are not the only ones who saw all these documents. And these documents were used by Christy Blanchard to promote a story and a false narrative, not only to the media and social media, but the lawyers used this false narrative to secure her a plea deal and ensure that Mommy Dead and Dearest was out and affecting the gene pool, the jury pool, before Nicholas's trial. Now, there are some discrepancies about whether Nicholas actually had a bench trial or a jury trial because he went back and forth. I don't remember. But there was an instance where at least the jury pool all stated they had seen Mommy Dead and Dearest. And there is a very good reason why Mommy Dead and Dearest was put out there as fast as it was. Okay? So, Taylor, F you. I can assure you, they don't care. Have a good one. So I'm going to go ahead. Christy's very two-faced, but I don't want to talk about her. I want to go through these medical records. We have put them into Patreon for you to see. It is going to be on our level 30, so it's $30. You are not paying for seeing the medical records. It's not what you're paying for. What you are paying for is for the knowledge and the research that me and Colleen and our team of experts did for the last 7 years, trying to unpack thousands and thousands of medical documents. Okay? So, in these documents, starting in 2000, which is in the 204-page document, and it is approximately the medical records from Louisiana, starts in on page 129 or 130 of this 204-page document. And starting there in 2000 is one of the most important documents. There's two very important documents in all the medical records that we have, and really only two that matter. The rest is all substantiated by these two tests. The first test is in 2000, and her birth date is correct. It's 7/27/91 on those files, and she is listed as 9 years old. What is being done is an EMG, and so it is being treated. The chief complaint is muscle weakness in both legs, and the procedure is a nerve conduction for both legs. And after this test is performed, it is shown that there is no electrophysiological evidence, neuropathy, radiculopathy, or myopathy. Hey, Sarah, would you like to come up? I can invite you to the box. Only Sarah, please. Nobody else in the box right now. Let me go ahead. Okay. And so in 2000, Dr. Garcia is the first doctor who starts working on this muscular dystrophy, actively trying to figure out what is wrong with her legs. Because it is absolutely 100% proven there was something wrong with her legs. She has a chromosome disorder. It is the very first thing that Dee Dee tells every single person about Gypsy and what she has is a chromosome disorder. Now in 2000, they began trying to figure out what this chromosome disorder is. And it is a genetic disorder. Hey guys, it's a genetic disorder. Okay, and what that means is it is passed down from generation to generation. And hey, baby.
Hey, how are you?
I'm good. This is passed down generation to generation. And what is going on is that in 2000, they do not have the technological advancements to understand what exactly the chromosome disorder is and what it does. They just know that it exists. They have determined that there is some sort of genetic disorder happening in all of this shit that is going on with Gypsy. All of her medical, she's having failure to thrive. She's having teeth problems. She's got muscle weakness. She's got ear problems, sight problems. All these things are happening from a very early age. And it was all 100% true. None of this is medical child abuse because these were actual conditions that she had that can all be explained inside of one chromosome disorder. But we don't know about this chromosome disorder until 2011. So in 2000, they're looking for what the chromosome disorder is. And the first test they do is the EMG. That's Dr. Carlos Garcia. Okay. Yes, it's live, guys. Okay. That comes back negative. Now, in that chart, as I've stated, her date of birth is correct at that time, and the actual accuracy of how old she is correct at that time. That is in the end of 2000. So 10/31/2000, this test is run. Now, in 2001, on 1/31 of 2001, Dr. Garcia comes back again, and they're going to perform a muscle biopsy. Now, they take a small amount of fleshy tissue from her right thigh. And the complaint listed here is type 2 fiber atrophy. Now, this is the very first time the birth dates begin changing. And the first thing that happens is from instead of it birth date changing, her birth date is still correct, 7/27/91. But the age is now wrong. They are listing her as 12 years old. Now, when Colleen and I talked about this last night, we came up with the idea that possibly either the wheelchair races or Special Olympics or some sort of benefit needed her to be 12 years old. And that is where, yes, she was really sick. Yep. Yeah, she's really sick.
Also, they get the age 12 is also important because that's like the cutoff for a lot of freebies. You got to be 12 and under for a lot of freebies.
Right, but they're changing it from 9 to 12. So there's a reason. There is something that they are looking to do with that change right there. I don't know what fraud they're committing, but it is definitely fraud right here in this document right now. And from this point forward, anytime muscular dystrophy is listed on any document for any reason, it is known fraud. It is known by the doctors. It is known by Dee. It is known by the organizations. And I believe this is the time period that she gets thrown out of the Ronald McDonald House. Because until 2007, and because of our technical difficulties, I've only got a 10-minute clip of Colleen explaining the 2011 results from last night. But in 2007, is the very first time we ever hear that there is cancer. And the first time it's hemophilia, and then it's listed as leukemia. And it's not until then. So it's well after Katrina, well after they've landed in Missouri, that they start beginning to do the whole cancer thing. Now, there was the cancer issue in the Superdome. I've heard several different stories of what actually happened during Katrina with Gypsy, several different countings. They say that she was in a place in Covington for 2 months. We cannot find any records of her being in any shelter, any clinic, anything for 2 months in Covington like they claim. We have no records. We requested them. Nothing came back. There was nothing to be found. Not that we couldn't get them. There was nothing to be found. Colleen and I talked about this last night. So we do not believe that she was in a place in Covington, because the only substantiated proof we have that she was a Katrina victim is inside the Superdome, where she is standing, or she's sitting in the sink and they are shaving her head. And after that happens is when she, Gypsy herself, goes and seeks out a doctor for Missouri and tells them she has cancer and leukemia. She has no medications and she must get out of there right away. And so they airlift her to Louisiana. Now, I wanted to
Airlift her
know,
to Missouri. Airlift her to Missouri.
I'm sorry, airlift her to Kansas City, Missouri, where Dr. Beckerman is one of the first doctors that she ends up seeing, along with Dr. Steele. And Dr. Beckerman,
Isn't that ironic that Beckerman goes from Louisiana to Missouri?
yes. And I'm going to tell you how this happens in a few minutes, okay? But I'm trying to give you just I've got to bounce around a little bit, but I'm trying to give you as much chronological order so that you guys can follow as needed, okay? So Dr. Beckerman, supposedly, he says several times, he says he came on when she was 4 years old. Sometimes he said he came on when she was 6 years old. Sometimes he says it was 7 years. So we don't know exactly when the first seeing of Dr. Beckerman was. It was prior to Katrina. It was in Louisiana. Now, inside of this 204-page document that is very, very important, like I said, both Flasterstein and her primary care doctor, Dr. Steele, both had this 204-page document as far back as 2005. Flasterstein got it on 4/18/07. There is a record of the faxing. There is a record of it actually being received. Okay.
So much for his claim that he had no records, as he stated in the documentary. That was a flat out lie.
Flat out lie. Flat out lie. I've caught him in several lies. Flasterstein lies, but we don't know which one is Flasterstein's lie and which one's Flasterstein's truth, because Gypsy tells two different stories about Flasterstein having her stand up, and she doesn't. She remembers that on Dr. Phil, but in Lifetime Confessions or 2020, she's saying she doesn't remember it, and that they should
they were covering their butts. She says, yeah, and that's in prison confessions.
Right. Okay, so what we're speaking on is 3 different documents that are going to be provided in our Patreon. It is $30 for you guys to see them for the month. Okay, after 3 months, you get perks. You get some merchandise. We're going to be giving you different things on that $30 level, and I'm letting you know what the $30 level is going for. The $30 level is helping us to fund the documentary and the book that Colleen and I are putting out. As well as I'd like to make my announcement in a little bit of what's going to be happening on April 1st. We're very excited about it. But let's go back to this. Okay, so we're in 2000 and 2001. Dr. Garcia has already run the the EMG. Okay, he's already run that. All right.
And by the way, that for people that don't know layman's terms, that's a nerve conduction test.
Yeah, we talked about that. We talked about it was nerve conduction for both legs and the whole thing. It comes back negative. So then in 2001, Dr. Garcia then decides to order a muscle biopsy. Dr. Bennett is who performs the muscle biopsy. The chief complaint is type 2 fiber atrophy. The procedure is a muscle biopsy to the right thigh. There is no muscular dystrophy. It is noted very, very, very clearly that there is no muscular dystrophy. And in this, it suggests the disuse of legs and possible CNS lesions. Oh yeah, Colleen's still here. You're going to hear from her in just a minute. All right. And it is considered a genetic disorder at this time, but they 100% know it is not muscular dystrophy. No, Colleen is not a guest. She cannot be here tonight. We pre-recorded last night. We had some technical difficulties. I've got a whole 10-minute clip of her explaining the 2011 results that are the most important part of this. Okay. All right.
So and the lesions are important because we don't know if the lesions are on the brain or spine.
We do not know where the lesions are. It just says central nervous system lesions. Okay. So then an eye surgery is performed that same day for astropia and disassociated vertical deviation. So this is the idea of the lazy eye. It goes a little further than the lazy eye, and it is a type of elective surgery that is highly suggested to be had. However, it is a surgery that they explain in this document and every other document we have. Oh, my goodness. I'm live, so I don't know if you want him on there. It's a chair.
Her little guy's here. Yay.
Hang on, guys. I'm sorry. Just hang on, guys.
Grandbabies are the best.
They are the best.
But his mother does not want him to be on camera, so that's why she just put her hand up for a second. Yeah. That's just out of respect.
We just try to keep him, you know, with all the issues that we have, especially with this case, we try to keep him very, you know, we try to protect him. He's our baby. We love him. He's 3. So anyway, okay. So this is a type of surgery that she has over and over and over again. And every single time they have it, they explain to her, 1, that that what they're doing, and 2, that there are risks that she could end up blind, and 3, that it's going to have to continuously be done. And she has it done over and over and over again, all the way up until 2011, where they're finally able to, they feel that they've corrected it as much as they can possibly correct it, and there is no more things that they can do. It is what it is, and it is where it is. Now, I don't know if she wears, contacts today. We had a discussion about this. Some people got upset about the fact that, you know, Sarah said something about people with stigmatisms can't wear them, and I guess you can. Some people can, some people can't. But
it depends on your type of it depends on the type of stigmatism that you have.
Right. Now, in her lifetime clip that we've all seen going around about her teeth, and the chemo that she did not ever have. Okay.
I love the picture they used the picture that they used. She's on a nebulizer, which is just an allergy, asthma treatment. It's not cancer treatment.
Right. Okay. So is that my daughter who pays for everything and I take advantage of? No, it's my daughter that lives in my home who I watch her child for, and we split the bills. That's how it works in our home. I don't know if you know how it works, Kendall, and it's none of your damn business. I thought I blocked you before. I guess you're blocked, baby.
Block.
Unbelievable. Anyway, so I just love how they love to come in and just try to distract us from everything we're doing. Okay. Where did she go? So in 2011, they stopped doing this eye surgery. And, you know, she talks about having bifocals at 14. There is no proof that she has bifocals at 14 in any of these files. There's no proof that she's wearing glasses. They suggest she wears glasses for astigmatism, and she doesn't do it. So either A, they were bullshit with no prescription in them, or they were bullshit. Either way, they were total bullshit. Okay.
And everyone that said that everyone that has testified that they saw her running around town before her mother was unalived have all said that she was not wearing glasses.
And there is in the files, there is patching of the eye, which is one of the things that they would have to do before doing these surgeries. There's all the different things that prove that this is a legitimate, actual thing. Yes, my love. A legitimate, actual disorder that she has and problems that she does have with her eyes based on a chromosomal genetic disorder that has been undetermined. So in 2001, she has the muscle biopsy and the eye surgery on the same day. And then they come back again. Hi, my love.
Can I be with you?
Oh, can you be with me in just a little bit? Be with mommy right now?
It's fine.
Okay. Okay.
I'm gonna put him up in your lap.
You want to sit in my lap? Okay. You're going to sit in my lap. All right.
Those cookies.
Are they cookies?
You can't.
He can be seen. Okay. All right. Sorry, guys.
Hi, little man. Hi, little man. You got the best nanny. He loves his nanny.
He does love his nanny. So, okay. So, yeah, here you go. We'll go with your mama now, right? Scooter. Okay. So, only one other thing is of note in 2001. In 2001, there is another MRI done. Dr. Garcia runs, just in case anything happened in the last 4 months since he ran the first, so in 2000, in October, he runs the first MRI. They all come back negative. Then he does the conduction study, comes back negative. Then they do the biopsy, comes back negative. On 4/2 of 01, they run one more MRI of the thoracic spine, the lumbar spine, the cervical spine, and the brain, and it all comes back negative. So they have 100% ruled out that there is any possibility of her having muscular dystrophy with over 4 different tests. But they still have a chromosome disorder that they don't know is what is going on. Okay? So we've ruled out muscular dystrophy. Anytime that we have muscular dystrophy, I don't know why I'm echoing. Anytime we have muscular dystrophy in the chart from here on out, it is definitely 100% considered fraud. Because every doctor from this point on out knows that at 100%, Dr. Garcia in 2001 proved that there is absolutely no muscular dystrophy. Now, Garcia's name is very important because when Flasterstein and Steele, you hurt yourself, I'm so sorry. So when Flasterstein and Steele both request this 204 page document that they do get, it is said that they spoke to Dr. Garcia and that Dr. Garcia says specifically that he knew that she did not have muscular dystrophy. So in 2004, there is a sleep clinic visit, which is interesting. At this point, Dr. Beckerman is now on a leave of absence. Leave of absence. He's missing. He never returns to the Louisiana sleep clinic ever again. He goes on a leave of absence. He heads to Missouri in 2004, a full year and a half before Katrina happens. And he is still treating her in both places. But he never comes back and sees her here. And in this, it's an interesting file. First of all, there is no date of birth listed on this document. Second of all, it's noted as an unclassified congenital neuromuscular disease. So not listed as muscular dystrophy, but unclassified and congenital. And when we talked last night, Colleen wanted to make sure you guys understood congenital is not genetic. It's not chromosome. It's not something that she can develop over time. It's something she is born with. She is born with an unclassified congenital neuromuscular disease. In 2004, in the sleep clinic, she has mild asthma and controlled rhinitis. What are you doing?
It just something's going on. Okay.
Yeah. It's making all kinds of crazy noises. Okay. All right. Sorry, guys. Sorry for all the distractions. Okay. All right. It's not that she's not diagnosed with it. It's not that she's not diagnosed with a chromosome disorder. It is that they do not know what the chromosome disorder is. So they're running further tests. Okay. So in here, though, I want you guys to know that this. Like these? Yes. I want you guys to know there's physical and mental components of this. We will get to all of that. Don't worry. All right. The other thing that's of note. Here, I need to send another invite to Sarah, probably. It is of note that this is the first time that Dee Dee tells a very specific story. Okay. No, Dee Dee is not being diagnosed with Munchausen by proxy. She does not have Munchausen by proxy. None of this is Munchausen by proxy. It is 100% a chromosome disorder that she has along with medical fraud. Okay. So, but here Dee Dee tells her first story. This is where Dee Dee states her memory is not good because of an accident she had 2 years prior. So this is the actual time that this happens, okay? 2 years prior is when Dee Dee and Gypsy were in the car accident, not the motorcycle accident that puts her in the wheelchair. This is before that. This is when Dee Dee ends up almost severing her foot, and she twists her foot around, and she forever has problems walking after that. And so she stays with her grandfather supposedly for a week, the grandfather that is, essaying them all that they've claimed, which there is no substantiated proof of that either. Does not mean it didn't happen, just no substantiated proof. Okay. And the family, after talking to them, after the lifetime confessions, does not believe the allegations being made. Okay. But this is the first time she's telling the story, and she's telling everybody it happened 2 years prior and that her memory is not good, because this is when they start changing things. Okay. So she's giving her cover story right here. Oh, my memory's not good. I don't remember things. So when they come back and they ask her a question, she goes, oh, well, I didn't remember. I'm so sorry. I didn't remember. Because it's always easier for her to beg forgiveness than to ask permission. So she is basically covering her tracks right here with this little story in case anything comes back that she's upset. Okay, that she's done something wrong. So that's 2004. Nothing else of note really happens in 2004. In 2005, she goes to the sleep study again, and it comes back as being, maybe she needs a better CPAP machine. It's very mild asthma. It's controlled rhinitis. Everything is good. Continue using her CPAP at night, and that's it. Okay. Katrina hits in 8/23 of 2005. I've already told the story about her getting on the air, air lifted out, the whole thing. And she ends up in Kansas City for 2 whole months. And she stays at Hope Lodge. And her dentist is who writes the actual thing, because to stay in Hope Lodge, it has to say that you had cancer at some point in time. Okay. Well, the dentist, who is a cancer specializing dentist, writes that she's having these surgeries and things from what he suspects to be cancer related. It is not. There is no cancer relation here at all. I don't know if the dentist wrote that because it's what Dee Dee told him, or if he wrote it knowingly that there was no cancer, because there's no cancer in the files at this time. Actually, child of God, I did get written permission from her. Yeah, I did. Have a good one. So, Dr. Steele becomes her main primary care doctor in Kansas City. He starts seeing her along with Dr. Beckerman. He's on the scene. Okay. And in 9/23 of 2005, he requests the Louisiana records, and he gets this 204-page document with all of her Tulane, and telling him that she does not have muscular dystrophy, yet he continues to notate it in the file as muscular dystrophy. Dr. Steele does himself, notates it over and over again. And now we have the changing birth dates constantly on the same page. On page 1, you'll have 1993, and then they'll say she's however years old, and it doesn't add up to 1993 or 91 or 95. And then at the bottom of most of these papers, once she hits there, it says 95. There's discrepancies back and forth. It's fucking nuts. I've never seen anything like it. It should have 100% alerted everyone at all times that something was going on that didn't make any sense. Okay? So, in 2005, there is a PT evaluation done. So that's a physical therapy evaluation done. And I felt like it was rather interesting because a lot of things are included in this report. It reports that Gypsy can propel her manual wheelchair about 50 feet. It states that she does not transfer on her own at all. This is Gypsy telling them this. You know how they say that, that Gypsy never speaks? This bitch is talking all through here. They talk about it all the time. They talk about how eloquent she is and how her vocabulary is very advanced. And then they'll go on to say, but her mom says she's got a 7-year-old learning capability. But we just mentioned that she's got this huge vocabulary and she's using it. So on the mat, it's notated that the patient can come to a long sitting position, but she moves her legs as if she is paraplegic, just like she did when she's in Aurora and she jumps off of the patio into the snow, and then she moves her legs like she does there because she's pretending that she's paraplegic. She's doing the same thing here, and they're notating it.
She literally lands on her feet in that video. It's so infuriating.
Right. Okay. It also says patient demonstrates full range in the bilateral lower extremities. Okay. It shows that she has some supination and inversion of her bilateral feet. That's something they can't fake. So that's true. It demonstrates tightness in back and hip flexors. She needs a new wheelchair, they're saying. She needs bilateral ankle, foot, or those stander things so she can stand up and hold on, and she needs more tests. Now, I want you to understand, back in 2005, which is the same year, and she's already just come from Katrina and happened, the Colleen family, which is the family they were staying with after she was thrown out of Laura and Claude's house, and supposedly, she is poisoning Laura, and Laura gets miraculously better. No substantiated proof of any of this other than them saying this. Nobody files charges. She goes to the Colleen family in 2005, and she's staying with them. And that mother starts to supposedly get sick, and Dee Dee's the one cooking the meals, and they're alleging that she's making this woman sick. They kick her out, and they find all these frauds, these credit card slips with the mother's social security number and Dee Dee's name, and she's trying to run all kinds of fraud. Okay. And in 2005, I found her actual arrest records, and she has all kinds of petty check theft. Passing welfare checks, passing bounce checks, all of these different things. So they're already trying to figure this out. They're like, something's wrong. Something's going on. This is not okay. But the Colleen family, after she tries to, credit card fraud them and supposedly take their mother's life, they still pitch in to help her get her habitat house 2 years later. Are y'all picking up what I'm laying down here? Is this
Have we covered in January of 2005 her visit with Dr. Wisdom and Dr. Love?
No, those are in the file, but we're not going over them. They're not in this list of things.
Okay, I'm just looking at my notes.
Yeah. We don't have that in this list of things today. That's not one of the ones I'm covering. So just letting you know. So there's fraud knocking at the door. They've determined she doesn't have muscular dystrophy. She's been thrown out of Ronald McDonald House at some point in time. Rod and Christy know what's going on. The Petrie family knows what's going on. She spends every birthday she had with them till she's 14 years old. She gets airlifted out on a lie to Kansas City, and she ends up there. Dr. Steele, at that time, tries to request her records, and he receives them. It is another 2 years before he sends her to Flasterstein, where he's thinking, hey, something isn't right here. But he has been told on multiple occasions, including by Dr. Beckerman, that she has some other chromosome disorder and that they need to keep running these tests to try and figure out what's going on. But it definitely is not muscular dystrophy, despite it being in the file, despite them using it for trips, despite them using it for what? Financial gain. So in 2007, we've got an audiology appointment where mom is talking about permanent ear tubes had been placed 4 years earlier, and she's concerned that they're coming out. Now, this was really funny. Last night, Colleen and I talked about it for a great long time, and I wished you got to hear that. We talk about these colon polyps that all of a sudden are listed in her history. And we're like, what the hell are these? We've never seen colon polyps. We've never seen them before, and we never see them again after. We think that this is Dee Dee's way of floating something new out there and seeing Are they going to bite? Do they take it? Do they run some tests on this? Is there anything else that I can put in there? But this is this is before cancer gets put into the file. This is still pre-cancer being put into the file. Okay.
I have a quick question.
Yep.
Mickey button.
Yeah. She's had it forever.
I think my notes in here say that there's just not much to go by on the Mickey button, but we were about 2001, perhaps, maybe it was placed.
We do not have the placement of the Mickey button. We do know that by the age of 7, it is there, permanently there, and that she was diagnosed as failure to thrive, which is very common in this specific chromosome disorder that we're getting. That we're getting to, and it is very much a normal way for them to treat the problems that she actually has at the time of placement. Now, the interesting part about the Mickey button is once it goes in, it's never maintained by a doctor ever again. It's only maintained in an emergency room when it is infected. The only time. There is no hundreds and hundreds of her having it changed out and monitored and all of that. No, it's maybe a handful of times that she ends up in the emergency room because it's fucking infected, because they're not taking care of it.
I mean, because honestly, if we go back through the medical records, it was actually, when it was placed, it would have been medically necessary based off of the chromosome disorder that she has, with her having the low, being in the low percentile, so low for her size and weight at her age. And it's just a really big deal. But I think what happened was it was placed because it was genuinely needed. Then they just kept it because it made a great visual effect.
It did. And then on top of that, it's shown that this is something that happens with this, and she can use this from time to time when she's having all of her different surgeries and problems with her mouth and things like that. And they even talk about, in this 204-page document, it is notated in here what she's using, what she's being fed, and that they are seeing a great improvement in her growth and her health from having this nutritional thing added. It's added. It's not the only way she's receiving nutrition. It is an added precaution to help facilitate better health and nutrition for her, because she's clearly not getting it other ways. This is the deficiency that's happening with inside her body, and she does need actual supplements to be given. Not through a freaking baby bottle, through her freaking feeding tube, because that's where it's supposed to go. Okay. Moving on. So they replace the tubes. And this is an interesting audiology appointment, because the audiologist pulls Dr. Wee aside and privately says that they believe that Gypsy herself may have some hearing loss, but was malingering, which I don't know if you guys know the difference between malingering and Munchausen by proxy, but it is very big. And it is the difference between financial gain and non-financial gain. If Munchausen by proxy, if the actual motivation of the mother or the caregiver is to be seen as a hero, or because there's some great mom, and that's the main motivation, that's Munchausen by proxy, if medical abuse is happening. If it is for financial gain, and that's the main thing, then it's called malingering by proxy. Very different. One is in the DSM-5, one is not at all. Okay. And even in the DSM-5, Munchausen by proxy is not listed as an actual mental illness. It is listed as a pathological disorder, and it falls under the same pathological disorder markers as pedophilia. And that was how the investigator out of Texas explained it to me. And when he sat down and he explained it to me, that was the first time that I was able to accept medical child abuse as being something that I could look at in this case and actually term it that. because for 7 years, I've had a really hard time calling this Munchausen by proxy. You guys have all heard me. It's not Munchausen by proxy. It's not Munchausen by proxy. It's not Munchausen by proxy. Well, I'm proving today why it's not Munchausen by proxy. And you guys have asked why this has taken 7 years to get to. Here's why. Because 7 years ago, when we started this, we didn't have a test from 2011 because somebody had it, but they were not giving us the results of it. And we're going to talk about that in a little bit here. But I want you to understand that there's a difference there between Munchausen and malingering. But in this text where they're saying this right here, they're saying that Gypsy herself is malingering, which means that she is trying to actively fake this hearing test, okay? And she's doing it, not the mother. She is doing it. It is put in the file as her, and that she is malingering. This goes to Dr. Steele. This is 4907, okay? She has some dental surgeries. She has an ENT. And then here again, in 07, Dee Dee's claiming memory loss after a car accident a few months prior. That didn't happen. That's the second time we see this story, and now it's changed. That's in 07. Okay? We're starting to see the dates change on the side more and more. Ages are all wrong. But in this one, it talks about purposeful movement of extremities as she is coming out of surgery. Because that was one of the things that I never understood. If she's paraplegic, when she's having all these surgeries done, these dental surgeries, eye surgeries, and ear surgeries, which are her surgeries, that she needed, what's going on with her legs? How could she possibly be faking it? Right? How could this be happening? Well, right
I
here.
have something in my notes too that I wanted to add to, is that when she did that sleep study in 2004,
Yes.
Beckerman was on leave, and it looks like Kiernan did it, Dr. Kiernan, and that
Yes.
they noted she had leg movement happening during her sleep.
Yes. So they're seeing her legs move all the time. And the reason no one thinks anything of it is because she does. She has this chromosomal disorder. They know that she has muscle weakness. They just don't know why. They can't figure it out. And it's not even that she's faking it. She really has it. There is really everything Dee Dee told everyone, that she has a chromosome disorder, that she has seizure disorder, that she has weakness in her legs, that she has problems with her teeth and her eyes and her this and her that, are all legitimate, actual things that are either caused by this chromosome disorder or Dee Dee knew were caused by a chromosome disorder, and she used those to play up the fraud along with the doctors that I do believe are involved in this. All right. So now in 2007, this is when Dr. Steele finally goes, all right, something's just not right here. I'm going to send her to Dr. Flasterstein. Okay. So in August of 2007, we get a letter from Flasterstein to Dr. Steele. And in the first line of this letter, it states, the mother is not a good historian. Okay? This is where Munchausen by proxy is the only time ever mentioned in a file ever. It's right here. And it's not even in this first letter. This first letter simply states the mother's not a good historian, that the chief complaints are muscular dystrophy and epilepsy. Here we begin to see a new diagnosis of family history. So now we're claiming that her paternal brother he has mental issues. That's paternal. And the maternal grandma is listed as having, and I know I'm going to butcher, Charcot-Marie tooth, okay? And that is, it would explain some of her problems. This is where the first time that hemophilia is listed. She has difficulty walking and nerve problems, okay? Now, we don't know if the maternal grandmother has this Charcot-Marie tooth or not, but it is, again, what they're looking for to try and figure out what the hell is going on with her, okay? So that's mentioned in the files there. The neurological exam at this time shows a diffused hypotoria but unusual distribution of her weakness, which means that they don't understand why certain parts of her legs are weak and other parts of her legs are not. She does the nerve conduction when they hit her with the little thing. She has regular reflexes. They just can't figure it out. Why can she not stand? Why is she having so many problems? Why does she have all these unrelated problems that we can't seem to figure out what any of them are causing them? Why is she having these eye problems? Why is she having these ear problems? Why is she having this? So they're trying. They're really trying. Okay. And so Flasterstein decides to order the records. He gets the records. He sees the record from Dr. Garcia, which prompts him to go ahead and order an MRI and an EEG. The MRI is done with and without contrast. And he does the brain, the cervical, the thoracic, and the lumbar again. No intracranial abnormality, mild thoracolumbar, whatever. Colleen will have to tell you guys that. So it's basically saying in her thoracic region, she has some mild things. And there is a barely perceptible mid and distal thoracic cord syrinx. So something is going on with her spine. They can see it. They just don't know what it is. Okay? So he runs those tests. They all come back negative. That's in 9/24 of 07. So she first sees Flasterstein in 8/21. A month later, she sees him to do the MRI. And then in November, we get a letter again from Flasterstein to Dr. Steele. Okay. And it is reporting that the mother is now saying that she has cerebral palsy and muscular dystrophy. Where the fuck cerebral palsy came from, I don't know. I guess that's just the next one on the Price is Right of let's figure out what she doesn't fucking have today, folks. And this is where he notates that he spoke to a Dr. Azarick, which is listed in her files. And she specifically remembers Dr. Garcia clearly reported the fact that Gypsy Rose does not have a muscular dystrophy. Initially, mom reported epilepsy, but the Tegretol levels are undetectable, and she has had no seizures, even with a normal EEG. So they're saying she's not having seizures, and furthermore, she's not taking medication like she's supposed to be for those seizures. So they know at this point the seizures are bullshit. And no one ever sees a seizure. No one ever remembers a seizure. It never happens where anybody can see it. It just happens to be something that she could possibly have from these disorders. Okay? And there's more to this. There is a slight decrease in muscle tone listed. The muscle mass is good, but the wrong answers are given to sensation testing. And when I talked to Colleen, she explained this as like, so if you're touching it and it's a cold thing that you're touching and they ask you and she's telling them it's hot, that would be a wrong answer to a sensation testing. And this is where he notes, for the only time that it's ever seen in the files, possible MBP. Okay, this goes in the file. This goes back to Dr. Steele. I don't have notes from here out. Colleen did. We didn't really cover a whole lot past here because this is where it becomes very important. Okay, so in 2007, now, not only is Flasterstein aware that there is something going on that is wrong, but so is Dr. Steele. But Dr. Steele continues to see her for another 2 years till 2009, when a call is made to DCFS. Now, in 2007, when this was all run, if Dr. Steele and Dr. Flasterstein had done their jobs as mandatory reporters, then she would have been helped in 2007 when she was still under the age of 18. But nobody does anything. And in 2009, there is a DCFS report made. Now, I know for a fact that what Dr. Steele says on the Lifetime Confessions and the 2020 interview is absolutely not what happened. He did not call it in as a kidnapping. And if he did, then it is notated wrong in the case files. But this is the first time since 2005 that fraud becomes a big deal again. Okay. This is the same time period that she is caught at the convention with Dan for 4 hours that she is missing while she's in her little Mandalorian costume that nobody can tell anything of what she's wearing or who she is or anybody that's under there. So she could have got up out of that wheelchair and walked all over the place and no one would have known it was her.
That was a perfect getaway costume right there.
Right. Okay. So in 2009, she's over the age of 18. Okay. She is caught with a man after missing for 4 hours from a convention that thousands of people are at looking for her for hours and hours and hours. And then she is found in a hotel room with this man in a sexual compromising position, walking, no problems, conversing easily. And everyone, including David Blanchard, Kim Blanchard, Dan, Dee Dee, all of them knew in 2009 that she could walk and it was all a bullshit scam. Now, the hospital also is getting wise to all of this because apparently a nurse catches finally that there's so many different dates on this shit that she doesn't know what she's looking at. And I think the nurse is actually who called it in to DCFS. And I think that Steele is covering his ass. But he swears that he's the one who did it. HBO was unable to verify that he was the one who did it. I am unable to verify that he is the one who did it. All that is called in is an anonymous tip from a doctor's office on fraud and possible Munchausen by proxy. So, 2 officers and 2 social workers go out with these medical records from Dr. Flasterstein in hand. That's why they're included in the records that both Patterson and Stanfield have when Gypsy and Nick are arrested, because it's inside of a fraud investigation file. Not because they went looking for these records, because it was inside of a fraud investigation that was currently active and open.
And what he calls in is just really absurd. He doesn't call in, abuse. He calls in a possible kidnapping.
That's what he says, but it's not what's listed in the case file. The case file lists it as possible Munchausen by proxy. That this is a case of Munchausen by proxy. It's listed in there. 100% it says that. It lists the chromosome disorder. It actually has the chromosome disorder listed in there. And those 2 officers were able to see a actual ID that proved that Gypsy was over the age of 18, as well as a birth certificate that proved that she was over the age of 18. And they do note that she has some sort of mental disorders that are apparent to them, despite the fact that they don't know what they are. But they definitely know this isn't Munchausen by proxy. Something's really wrong with her. She's over the age of 18. There's nothing more we can do. So it took him 2 years to call it in, folks, and she's already over the age of 18 by the time he does so. And they can do absolutely no things. Does he stop seeing her? Does he do anything else? No. You know what he does? He and Beckerman move her care back to Kansas City for 2 more years until 2011. And I have Colleen talking about this. It's a 10-minute clip, and then I will explain to you exactly what page, what I'm looking at here, what she's talking about, and then we're going to talk about this actual chromosome disorder. So let me go ahead and play Colleen's little thing here. Let's see. I don't need the intro. There we go.
Dr. Lepachon actually gave a shit and ordered a cytogenic and genetic test done on Miss Gypsy Rose Blanchard. And it determined that she was of normal female karyotype. And then the first genetic test showed that there was no chromosome abnormality. However, this neurologist doesn't believe it. Does one anyway.
Okay, I want you guys to understand something. That is the test that Colleen is reading from in 2019 when we did the podcast. It is also the last page of a document. It's the next to last page of this 19-page document that you have in Patreon. Okay. In this is where it says that this test comes back negative, like Colleen just said. But Titania brought it to me and showed me and said, hey, no, I think this test is real. I think she really does have this chromosome disorder. I'm really concerned about it. And they should get Mia tested to see if she has it or not. And we went round and around. Colleen went round and around with Titania. And at this time, Titania was the one in charge of all of the medical records. Titania is the only one who requested medical records with Christy Blanchard to get medical records. Now, Christy already had all the records, just so you guys know. I can prove that. But they did not have this one document from Dr. Steele because we ended up having to fight for this document, this specific document that we're talking about right now. Okay. And Colleen kept telling her, but it comes back negative, Ty. It came back negative. She doesn't have the chromosome disorder. Except that she had page 18. She didn't have page 19. She didn't have the document that showed that they continued with these further tests. And here's what she finds.
And the reason was for developmental delay and for quote-unquote muscular dystrophy again. Though we know it's not that this time, again. And we finally have the technology in 2011 to run this comprehensive genetic chromosomal test. And it finds that it is abnormal. This is her blood. There is no question, no speculation, no, I just looked at her, she had this. This is her blood in her DNA. She has 1q21.1 chromosomal abnormality disorder. Interstitial deletion of chromosome 1q21.1 in her blood. Of note, they made some comments that this 2.74 MB, and that's the length of how long this deletion is, interstitial deletion of the chromosome 1q21.1, identified in this specific patient, in Gypsy, contains more than 20 annotated genes and transcripts. There is a single copy of these genes instead of the normal 2 copies in each of her diploid cells. The deleted region is the susceptibility locus for neurodevelopmental disorders with highly variable phenotypes ranging from asymptomatic to severe developmental delay and multiple congenital, or born with, anomalies. So they order paternal studies. In this paternal study, we have the documentation. Dee Dee was tested. Dee Dee was negative. They tried to get in touch with Rod, and he did not answer. So now I want to talk about what this disorder is.
Okay, before she goes on to explain this disorder, I want you to understand that is in 2011 when all the medical stuff stops. There's no more medical fraud anymore after 2011. Okay? She's not going back to the doctors all the time. She goes for a couple dental caries, and the day before she decides to kill her mom, she has her feeding tube changed out one more time. God knows why. Okay, and I've talked about why the feeding tube would or would not still be in her at this point. It could still be necessary. It could also, like Sarah said, just be for cosmetic things to make a really good story. It can be all kinds of different things, okay? But she definitely still has it, and it's there, and they're doing stuff, okay? Now, this deletion is proven that she has this. She's had it the entire time, and it can explain every single thing that she's ever claimed her child has is tied up inside of this disorder. And Dee Dee is found not to have it. But the Blanchard blood, that blood runs deep. And there is a whole thing about, I talked to Christy about Gypsy's voice at one point in time. And I was saying, it's just so high pitched. Why isn't it high pitched today? When we were looking at the trial. And she said, oh, because, she's nervous right now. She's not nervous, It changes for this reason or that reason. And then she goes on to explain to me that Rod's grandmother, I believe it's the grandmother, was 4'11", with the same kind of problems, with the same angular face, with the same high pitched voice. And it is all part of this chromosome disorder. And I believe this is what Christy and Rod have been trying to keep the public from knowing since the moment that this case broke. I believe they've all known about it for a very long time. And I believe that Christy doesn't want anyone knowing that it comes from her side of the family, which is why they have vilified Dee Dee so damn much. Because for a person who wrote me a letter begging me not to villainize her mother and make her out to be some crazy monster, she sure has done a damn good job with Christy of doing so. Now, side note, Christy and Rod are blood related, way far down the line, but they are 100% blood related, which means Christy herself could have this chromosome disorder that we are talking about, along with Rod and the rest of them. So let's hear about this disorder from Colleen, shall we?
Yes. So the deletion I'm talking about, the 1q21.1 microdeletion, can be found in the public. And some parents of children do not have any unusual characteristics. They're almost non-existent, or they could be mild, moderate, or severe. For Gypsy, we see that more moderate or moderate to severe deletion. And the most likely features, now think back to what I've just told you, include a small head, possibility of a mild or moderate developmental delay, unusual facial features, increased possibility of behavioral or mental health problems, loose joints or double jointedness, seizures, eye disturbances, an increased risk of other inborn anomalies or hereditary conditions, which we can see in Gypsy. And we can see the same facial features in other Blanchard people. So it's
both Mia and his other daughter, Nicolette, both have that same facial features. The same angular shape, the triangular shaped face, the inset eyes that are kind of back in the back of the sockets of their head that are kind of cross-eyed in. Mia does a great job of makeup and filters to cover this up. Okay?
I have a question, and it may be addressed by Colleen later. I'm sure it will be. But if Gypsy were to have a child, since she does have this chromosomal disorder, is there a possibility that her child would have it as well?
An extreme possibility. Extreme possibility. Yes. And the behavioral symptoms that Colleen is about to get into are fierce. And we are watching it. And this is where doesn't play well with others comes into factor. Because in the document that I'm going to show you, on the document that Colleen is going to talk about right here, and I'm going to show you in a second, it explains exactly what familial type of relationships cause in this specific chromosome deletion, of what types of dynamics it creates. And while it does seem that Dee Dee and her might have had this, it's stemming from Gypsy mainly being this behavioral child with these behavioral problems that
It does list that with this chromosomal disorder, that most patients that have this are very highly inclined to have schizophrenia. It just goes with it hand in hand.
That's what okay, so that's what we're going to talk about right
Specifically
now.
makes her face look triangular, that anteater look. Right? When you see other people with this condition, it's like, wait, whoa.
No, Little Red. No one said Rod didn't have it. Rod didn't get tested. Christy didn't let him get tested back then. Christy has not let Mia get tested since this. She will not give us the Dr. Petrie's freaking the Bayou doctor that is their family doctor's records. She would not give them to me, even though Mike Stanfield's paralegal tells me that she has them. Christy lied and said she did not have them, all because they are hiding this chromosome disorder. And it runs on Rod's side of the family. But what I'm telling you is Rod and Christy are blood related down the line. Does that make sense? I hope that makes sense. So he couldn't be reached. Dee Dee was tested. She does not have it.
Now these loose joints or double jointedness, if you can recall a video where Gypsy is holding up her arm with Dee Dee, you can see her double jointedness. You can see her elbow pop out in a way that it shouldn't. But low muscle tone was fairly common. So that hypotonia or low muscle tone, which is mentioned in Gypsy's chart over and over again. Other symptoms also include seizures, which is reported for Gypsy, though her EEG was normal. That doesn't mean that she wasn't having seizures. There's also the disturbances of the lens of the eye and other eye problems. Remember that she has the multiple times that she needs eye surgery. Other things include that failure to thrive is very common at birth. Yep, it said that they have growth problems and feeding difficulty, and that they have hearing problems, either hearing loss, and they are at extreme risk for otitis media, even as adults. And so remember when I said I kind of have changed my opinion about the ear thing? This is what I mean, is that this condition makes somebody at risk for having reoccurrent otitis media ear infections, needing those ear tubes. So I didn't know she had this condition, and as an outward person, adults needing ear tubes is almost unheard of. Right, so I just want to point out, change my opinion now that I have more information. Now lastly, what's so interesting is that they have an increased risk of behavioral or mental health problems. So you can have an increased risk of schizophrenia. And schizophrenia is the most common mental health condition for people with this 1q21.1 microdeletion, but they're also at risk for antisocial disorder, hyperactivity, autistic-like behavior, aggressiveness, and hypersexuality. It literally explains everything this girl has had. So I just want to point out that this really does explain all of Gypsy's actual symptoms and about 95% of her doctor visits. And that, is there embellishment? Hell yeah. There's embellishment with what she says. Oh, well, Gypsy has leukemia. Gypsy has hemophilia. Does Gypsy have either of those? No. But what the main symptoms that she is reported to have, what the main doctor appointments are for symptoms that she would actually have with this disorder. And this is not me or Fancy speculating on, oh, she could have this. This is a test result from her blood. She has this. And if she's listening, Gypsy, you have this. I'm not making it up. I have seen your test result.
That's Colleen telling her that she needs to get tested. Colleen is very concerned for any children that the family might have, including Mia. Okay. Mia does seem to have a much milder form of what this is. But the interesting part about this is a lot of the mental part of this, the schizophrenia, the aggression, the behaviors that have been displayed, especially by Gypsy, are all part of this. But what I found fascinating was that some of it seemed to actually mock what we see from mothers in Munchausen by proxy. And so the mental components of this are huge. And I wanted to show you. So let me share my screen. I want to show you this. Okay. So here we are. And I want you to look. First of all, this is from rarechromo.org. This is the actual document that Colleen sent me to help us understand exactly what it is we're looking at. And I want you to look, if you can, let me see if I can kind of, do you see this person on the front there, Sarah? Can you see it?
Yes, I absolutely can.
Okay. So in our promo, I put a picture of Gypsy right here. And this is where Sarah was helping out. You know, she helped me with that picture. She also helped me with the penhead. So yes, penhead, the microcephaly, it is part of this disorder, and she does have it. It's in her files that she has a small head. So the penhead disorder, it's part of this. And if you're looking at this right here, you can see where the angular of her face is triangle. And then she's got these in real close in eyes inset to the nose, and they're kind of socketed in the back there. I mean, look how much this person looks like Gypsy.
It's definitely, you can see that 100% in the shape of the eyes and the location of the eyes.
Correct. Okay, so let's go. So this is their pamphlet from Rare Chromo. And it says it's a very rare genetic condition in which a tiny piece is missing from one of the body's 46 chromosomes. The tiny missing bit raises the risk of learning, behavior, and mental health problems and physical abnormalities. But there is a wide individual variation. Individuals with 1q21.1 microdeletion range from people with no symptoms to others with developmental delay and health problems. And so this goes on to, it shows you what this deletion is, where the deletion happens. It comes all the way down here where, like, small head, increased possibility of mild or moderate developmental delay. She's got slightly unusual facial features, increased possibility of behavior or mental health problems, heart problems, loose joints or double jointedness, seizures, disturbances in the lenses of the eye, and a risk for other inborn anomalies. So small head is one of the most likely features. And they actually say right here, there is a possible link between the head size and the mental health problems, particularly with schizophrenia. Now, I'd like to ask you guys, in her book, what does she say her mother has? Schizophrenia. Her mother has never been diagnosed with schizophrenia. Not one time. Never. But here she is telling in her book that she grew up with a woman who had schizophrenia. But, okay. So now it doesn't mean that everyone with this deletion is going to have small head, will develop schizophrenia. But it's just something that they think that is really interesting. And 3 out of 7 members have a relatively large head. 1 is average and 3 are small. So some kids develop at a normal rate and cope well with support. Mia would have been a candidate for that. And they should be monitored vigilantly for delay, and extra help and therapy should be sought and offered promptly. It does make it possible to predict. It does not make it possible to predict how mild or severe the delay and the learning difficulties will be. The spectrum includes people who have no noticeable problems all the way up to those who are profoundly affected. If you come down here, talks about the slightly unusual features, the heart problems. We've got our loose joints and her double jointedness, the pen, so all of that. But here we go. And this was the does not play well with others section. This section right here talks about all the different mental and behavioral problems that can result as a deletion of this 1q21.1 chromosome. Okay, it can affect. They can be affectionate and sociable with no behavioral problems, but as a group, they appear to be at risk for a range of behaviors, difficulties, and mental health problems. We do not know yet whether these unusual behaviors and mental health problems are a result of the 1q21.1 microdeletion or a chance association. This is particularly true when a parent and child have a similar behavior pattern and both have the 1q21.1 microdeletion. Now, Dee Dee doesn't have it, but who might? Rod, Christy, Mia, the lot of them might all have this. And if Christy has it, it makes absolute sense to me while she and Gypsy do not play well together and have the problems that they have with each other, as well as together in the ways that they behave and are trying to twist a narrative and con the world. I told you the veil was really, really thin on this. And as soon as that veil falls, you can never unsee what you have seen. And it all begins to make sense. And it's right here. The increased frequency of behavior difficulties suggests vulnerability in this area and means that children and adults should be monitored and families offered early support. The key concerns that have emerged so far are listed below. Attention deficit with hyperactivity. This has only been observed in children with learning difficulties or developmental delay. Antisocial behavior seen in parent-child pairs and those whose deletion has not been inherited. Aggressiveness, this has only been seen in children with learning disabilities. Autistic-like behavior, this has only been seen in children with learning disabilities. And Gypsy does present some autistic-like behaviors. Anxiety seen in parent-child pairs and those whose deletion have not been inherited. Depression, this has been seen in parent and child pairs. Hallucinations, that one really, wow. Schizophrenia is more common among people with a 1q21.1 microdeletion than in general population. It is possible that small head size may somehow be involved, but the link is not yet clear. People with the 1q21 microdeletion and schizophrenia respond to neuroleptic drugs in the normal way. That's the study that talks about this. Unique families reported marked mood swings in their children with fierce temper outbursts, screaming, aggressive, and stubborn refusal to conform. However, patterns vary, and children and adults can also behave differently. On a good day, he's such a light in our lives. He can certainly make anyone laugh. Then it goes on to talk about seizures, disturbances of the lens, increased other inborn anomalies. She could have missing ribs, extra fingers, toes, webbing, club feet, unusual brain structure, increased fluid in the brain, minor genital anomalies, birthmarks, tongue ties, hernias, cleft palate, lung malformation, small kidneys. I mean, it just goes on and on and on. Feeding, growth, health and well-being, hearing. So this is the document and a couple others that we use to form our opinions based on her medical files that do include in 2011 this actual deletion. It's not a specific disorder. It's just a specific chromosome deletion of a specific chromosome. So there you have it, folks. And in 2011, again, the gig was up because the hospital was once again calling for a guardianship paper from the courts, not the POA, a guardianship paper. I rest my case. She does, in fact, have a chromosome disorder that explains everything that was ever done to her, ever.
And I'm sure it's going to take a little while for this to sink in, but I ask everyone to please look this up yourselves, do your own research and see what you think, because we're not, dissing anyone. We are not making like false accusations. I mean, as you can hear from Fancy and a medical expert, that this chromosome disorder is in her blood. She tested positive for it, guys. We're not
There's no way
making this up.
there's no way that this is fake. Just like all the other tests that we couldn't figure out how she was faking them all, the answer is she wasn't. She wasn't. She was never faking all of the things that Gypsy actually had done and put in her file. The only two things that were not true is it was not muscular dystrophy and she did not have cancer. She used those two things, cancer and muscular dystrophy, along with the doctors that got paid for this, for financial gain. And that is what Gypsy testifies to in court under penalty of perjury. VDK, if you don't know what the purpose of the revelation is, honey, I can't help you.
The revelation is that she has this chromosome disorder, and that she, excluding the cancer lie, the muscular dystrophy lie, all of the other things that she had, she really did have.
There was no fraud. There was no abuse. This was always okay. VDK, then you didn't listen to anything I said, and I'm just not going to answer you because you didn't listen to anything we said. I explained to you that there was a blood relation between Gypsy, Gypsy between Christy and Rod. Okay? I'm not assuming anything. That is an absolute fact. Have a nice day. Bye-bye.
Everyone, they are related. Everyone down there is related.
They're all related. Titania is even related to Gypsy. I found that out many years later. That's Dee Dee's best friend. That's who looked at all of these results. Okay? That's who looked at all these results and caught it the first time. She's the first person who caught it. Okay?
I'm even curious. I'm very curious to find out how Dr. Petrie is related.
I would love to know how Dr. Petrie is related because none of the names down there, there's only a handful of names. Okay? Every single time we would start talking about this case, I would go, well, wait a minute. We already have a Colleen family. Is this more of the Colleen family? And Christy's like, well, they're all related. We're all related in some way. Okay, more Colleen family. Oh, is this the Bland part of the Blanchard family? Oh, yeah, we're kind of all related in the same way. That's what I kept hearing over and over and over and over and over and over again. And after Titania had left, after she turned all the records over to us, I was looking for something, and I caught that Emma's, which is Dee Dee's mother's name, is just Claire, her maiden name. And I was like, I'd never seen her maiden name before. I'd always just seen her as Emma Petrie. Well, when I found that, I messaged Titania. I was like, are you related to Gypsy? And she's like, oh, yeah, way down the line. The same thing that Christy told me about her and Rod. Yeah, we're related somewhere down the line. Well, okay, chromosome disorders of this nature happen in families where trees don't fork all the way. It is,
and I've never exactly. There is no fork in this tree. But another thing is, I think people need to really realize this is that I have never in my life seen a medical disorder where it says specifically that people with this disorder should not. Yes, they should not associate with each other, that they don't play well together, basically. I that just blows my mind.
I know. I think it was so funny because I was reading her this document and she's like, are you sure this is a real pamphlet? I was like, yes, it's a real pamphlet. I need the address for it. Give me the URL for it, the URL for it. What is it? I need to see it. I don't believe you. Are you sure this is a real, is it written by a reputable? I'm like, yes, it is. It's rarepromo.org. I'm like, it is. And so that was where it came from. She's like, so Betsy, did you just say that the people that have this don't play well with others that have this? And I went, yeah, that's exactly what I just said. And we are
Right.
witnessing it in real time.
I said, I feel like this is the movie Gremlins, where they say, don't feed them after midnight and don't get them wet.
Yeah.
It's like, if you have this chromosome disorder, don't associate with others that have it because they won't get along.
And
That's
the thing.
crazy.
And like you said, Little Red, it is. This needs to be out there because this 100% shows that the doctors were not doing anything wrong. The vast majority of them, they were all absolutely 100% looking for a chromosome disorder the entire time. They didn't know which one it was. They couldn't figure it out. And it wasn't until 2011 that, first of all, there was advancements made enough that they could do so. And then on top of that, some doctor finally decides, hey, I'm going to do a whole comprehensive panel. Fuck this little bullshit of looking for this thing or that thing. We're just going to look for the whole damn thing. And one of the things we talked about last night is genetic testing is damn near impossible to have. Okay? Genetic testing doesn't just happen. You don't just go to your doctor and they give you a referral to a geneticist and genetic testing happens. It doesn't. Okay? In fact, right now, my daughter has a disorder that's very similar to this called Ehlers-Danlos syndrome. And it is an actual deletion of collagen in her body. And it makes for the weak joints and all the kind of different things that this has. And one of the ways to prove that, there's only one way to actually prove she has it full on. They've already put it in her file and they've determined that this is what she has. But the only way for them to come up with a full diagnosis of this is for her to go to a geneticist, and it is a 5-year wait. 5-year wait. Okay? So it's not like the doctors just weren't doing their jobs. They were. Now, there are two doctors, 100%. Dr. Beckerman and Dr. Steele are very suspicious in all of this. Very suspicious in all of this. And I would probably say Dr. Petrie, since I don't have her files, and there's just some questions I have for her. Supposedly, she's who threw Dee Dee out when she asked for the wheelchair, according to Christy. Okay. But yes, Parrots and More, she was sick. She was an actual sick kid, and her mother played it up. And the doctors helped, all for financial gain. That's it. That's the end of the story. There's no more to it. And that's why I have repeatedly said this is not a case of Munchausen by proxy. This is not medical child abuse. Gypsy was not abused her entire life. She has a chromosome disorder, which on top of proving all of the medical things that she has been through, it also proves that the mental disorders that we are watching her display very, very apparently are related to the same chromosome disorder. And basically, I mean, Dee Dee created her own murderer by fostering those behavioral issues.
And another thing to note too is that while Dee Dee made the claim that Gypsy suffered from cancer, she was never seen by an oncologist.
Never. No chemo, no oncologist, none of those things. And she doesn't even mention it until 2007. And it's mentioned one time as hemophilia first, and then it becomes leukemia when she was 5 years old, when they have no records. And they know they have no records of this. They weren't lost in Katrina. They weren't, there were some that were put on hold that we did have a harder time obtaining later. But with this 204-page document, everybody who saw it knew exactly what was going on and continued to perpetuate medical fraud. And that's it.
Do the viewers, because I can't see the comments, but do you guys know how huge this is? How huge
they are? Yeah.
This is. It is astounding. I mean, this is massive. This is massive. This needs to go out to the whole world. All major networks need to be notified of this. This is huge.
Major. It blows the case completely wide open. It changes everything. I told you I had it. I told you I knew these people. I told you that I wasn't lying. I told you they drove me crazy. They did. They drove me to the brink. And they are actively trying to do so now by using intimidation tactics. They have tried to say that Colleen's license is going to be pulled because of this. There is absolutely nothing that Colleen has ever done that is wrong. We did not forge documents for these medical records. We were given them directly by Christy Blanchard. She gave them out to many other people, not this specific one. And it was hidden, very, very well hidden within the files. It is
Exactly. I feel, honestly, my honest opinion, the first thing I said to you when, it was just when you rediscovered the files and saw, that you had this massive, huge bombshell. I said, all the other medical records that they supplied you with literally sent you intentionally on a wild goose chase.
Yes, it did. It did. And for 7 years, that's what kept me out of the case file. Okay. And I got these. I want you to understand the reason that I have these documents and the way that I got them after I released the interrogation video. After the whole fallout with Gypsy and Ken and all the things that they say they fired me for, and all the things that I've supposedly done to them, and all the things that I've supposedly done to Natasha and Ryan and all of them, all the things that they have alleged is 100% untruthful. And I was given these documents after releasing that, for one specific reason and one specific reason only, because they thought I would have no fucking clue what I was looking at. And for 7 years, we didn't. Colleen went back to school and got a master's degree in nursing education, and I went back to school, and I am finishing up a BS in forensic psychology to understand this shit. It took a lot. This was not just something that we just came up with in the middle of the night one night. This took a lot of effort. And when I sat down last year with the Tarrant County investigator, it was what changed my thought process on how to look at this case. Before, I had been running in so many circles trying to understand how the doctors could have fucked up so goddamn bad. That's all I cared about. I didn't care about the case file. I didn't care what happened on June 15th, June 9th, 2015. I did not give a flying fadoodle because that was pretty clear. We had confessions, we had whatever, and it kept me off the trail of really looking at reasonable doubt in this case for Nicholas. On top of that, I do want you all to know right now, those emails between Dawn Boker and Nicholas were written well in advance of her ever even speaking to me for the first time. And I have that information as well. And she has always been friends with Christy Blanchard. Christy is always friends with anyone and everyone that comes across my path in some way. Why? Y'all want to know who the common denominator is? It's really not me. It just so happens that I'm the one who knows all this shit. So she tries to make sure that every single person that ever crosses my path either thinks I'm completely 100% fucking hard crazy, or they're pissed at me because I call them out on their bullshit because they didn't do the work they were supposed to do. And if they had, then our company would have been grown by leaps and bounds, instead of me and Colleen and Christina working our asses off for 4 years to put ourselves in the position that we are in. There has never been a time in 8 years that someone directly connected to Christy Blanchard was not in my drive, in my head, in my home, and in my company.
And in your ear. In your ear.
Constantly.
And I have a question. And it's Colleen may know the answer to, but with her having the chromosome disorder, we can see that one of the things she does not have is the intellectual disability. She's
I wouldn't say that.
extremely smart.
No. Okay, okay, and this is where I come in, because this is what I did work on. And I talked to my professors and things about this in my work as a forensic psychologist. And just because intellectual delays do not seem to be present in the way that you're thinking, her intelligence is not necessarily the only indicator of an intellectual delay. Now, people like Nicholas, myself, those of us that are on the autism spectrum disorder, like my child, that's all considered an intellectual delay of some sort, because our brains don't work properly. And so it is likely that she has delays, that there is learning disabilities. And it does talk about the fact that the learning disabilities, that they can catch up eventually. So all those years are, when I'm not a forensic psychologist just yet, I have 4 more classes. Okay. All those years where she's saying she's delayed, she absolutely could have been delayed at that time and eventually caught up and surpassed those specific disabilities. Does that make sense?
Yes, and that was actually just the first part of my question. The
Right.
second half of my question is, how does this chromosome disorder with the mental problems, as far as like schizophrenia and various different mental issues that can happen with humans beings that are born with this chromosome disorder, how do you think her being positive for this chromosome disorder affected her relationship with Nick, who had such severe autism?
Based on what we're looking at, I mean, it could definitely be a factor in the ways that she interacted with him, for sure. But it also, I've always said that she's really good at spotting, and Christy is too. This is something that they are really good, as the pair of them, of spotting weaknesses in different people and what those weaknesses are, and playing to the weaknesses as well as playing on the weaknesses. And so for me, they understood how insane it is for me to not have pieces of a puzzle that I don't understand. I'm a type of person that I have to know it all. I don't care if you went to the bathroom on Tuesday at 2 p.m. I want to know. If it happened in this case, I want to know that it happened. So they were really good at realizing that they could manipulate me with information. And then on top of that, they were able to manipulate my specific problems with, communication and having friends and all these different things. Same thing with Nicholas. She was able to suss out very easily, because of her own psychopathy. She was able to suss out these weaknesses in Nicholas and play to them, and manipulate him. And she was able to cause him to do things he would never otherwise do. I've said that from the very beginning, that Christy and Gypsy are able to somehow convince massive amounts of people to do things they would never do, including myself. And all the people that you have heard me talk about in the last 7 years, every single one of them has been 100% manipulated by these 2 women, including all of you. Every single one of you.
It just seems like with her disorder and Nick's disorder, that it was the perfect storm.
It was. And we said that a long time ago. If she had found just a regular guy to say no, and she did, she found lots of guys that said no. But when she played up, and I've always thought about this, she talks about how he introduced himself as a 500-year-old vampire who enjoyed killing, named Victor, correct? We have no proof that happened. We have no proof that is how he introduced himself. What we do have proof of is that she was into role play long before she was ever with Nicholas, that Dan suggests that she even brought it to him, which would be part of the hypersexuality that we have seen inside of this own disorder, as well as what the jail guard said about her having extreme hypersexuality while in jail. There has been things of it while in prison. She was gay for the stay, you know, and all that crap. And she was caught in the stairwells. And I mean, there was so much that went on. So, you know, I think that she was able to she's very, very astute at recognizing weaknesses, both her and Christy, and manipulating those weaknesses.
And we
I
know
think that she introduced to Nicholas the role playing, and then maybe he took on the 500-year-old vampire who liked to kill him. Can you stop ruining that?
I absolutely agree with that. You can see how she manipulated him. And also, I kind of, this is kind of just something I like, kind of a hunch, a theory that I've thought about is, we know she is a very, very hypersexual individual.
Yes.
I believe that she was born that way.
Yes.
Now, we know that Dee Dee was negative for the chromosome disorder, and Rod was unavailable and did not cooperate with testing. This is just my theory. I believe that there's a possibility that Rod is hypersexual, because if you look at it as a teenager, he was running
around putting his wee-wee in anybody who would let him.
He had 2 children and was married as a teenager, and then also began dating Christy at the same time.
Yes. 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 So, we've covered a lot today. I think we've done a really great job of explaining from 2000 to 2011 exactly what was in her medical files that were important. I'm never going to release thousands and thousands of medical records. It's just not going to happen. There's no reason for it, first of all. You wouldn't understand what you were looking at as a lay person. I didn't. That's for damn sure. It took hours and hours and hours of this. But it was the Tarrant County investigator who made me go back and look at this. And I came back to Colleen and I said, I think we need to look at that chromosome disorder one more time. And she said, Fancy, it was negative. I said, no, I don't think so. I really don't. Colleen, I swear to you, Titania was very, very clear that it was not. And I need to know why she was clear on that, why she was so adamant about it, and why Christy would not have me attested, and why we don't have Dr. Petrie's files. Colleen, we have to know this. We have to. And so she started looking, and she found it as the very last piece of the document that we have in Patreon. And she had been given all but that last piece. And every time she asked for that last piece, she was not given that last piece. When I when we fired Titania, and we let her go based on her relationship with a baby killer, and how that baby killer was manipulating her into being a victim again, because Titania is super susceptible to manipulation. She was manipulated by Dee Dee as a teenager. She was manipulated by Christy throughout this whole thing. We've seen it. And her daughter even admits to it. And so Titania is very susceptible, and she fell in with Lacey Spears. And when she fell in with Lacey Spears, it became very concerning for me, Colleen, and Christina. And we went to her, and she got crazy about it, and we let her go. And when we let her go was when Colleen finally got, all the medical records turned over to her completely. And when she went back and looked for this document, I mean, within 5 minutes, the other night she had it. And she goes, oh my God, Fancy, you're right. It is true. It's true. And then she sent me this, she started sending me the literature on it from, medical journals and this organization and all these different things. And it began to be very clear. And so then we started in 2000, where they're looking at the muscle biopsy, which is the earliest date that we have of anything, And Colleen began to put this together of in 2001, 100%, they knew they did not have muscular dystrophy. They continued to put it in the file for financial gain. And in 2007, they added on the cancer. She used it once in Louisiana to get her airf lifted out. Gypsy was a willing participant in all of this, had to be. And on top of that, she knew she was sick. Gypsy knew she was sick. Dee Dee knew she was sick. Christy knows she's sick. It's why she does still have problems, regardless of what they want to say or not. Thank you very much. I appreciate that. And so it has been a mad dash to change the narrative of the story before everyone ever heard it. And that's why Mommy Dead and Dearest came out when it did. And I have proof that Aaron Lee Carr and HBO and Christie had all these documents at the time that that was made. And before she struck her deal, her plea deal, these documents were mailed on a USB file this big, saw it with my own eyes, from HBO to Christie. And they were given a call. Colleen deserves she deserves an award. Okay. They were given a USB file. And in that letter from HBO to Christie, it states that they included a USB for their attorney before she took the plea deal. They had been working on Mommy Dead and Dearest for over a year from the moment she was arrested. Almost. And it was long before she took her plea deal. And it was long before Nicholas got his trial. And if that doesn't say reasonable doubt, I don't fucking know what is. I told you there's corruption in this system. There's corruption in the hospital system here. There is corruption in the justice system here. And no matter what you think about Nicholas Godejohn, there is 100% reasonable doubt, and he deserves a fair trial. That's it.
And absolutely 100%. I think to realize is that, Dee Dee has been so villainized throughout all of this from, that was from day one, but she genuinely was a mother that was concerned that her daughter was not well, that was not healthy. And in the beginning, her genuine concern was real. And now that this chromosome disorder has been confirmed, the things that she was concerned about, the medical treatments that she did seek out at the beginning were necessary. And then it just kind of snowballed into fraud.
Well, I think it really started off as, honestly, my opinion is that it started off as a way for her to keep a wandering man. Because he came back several times because of these things. And she had a sick kid. And Rod, I just need you so badly. And Christie did not give a flying foodoodle. No, just give up on that sick kid. You don't need that sick kid. You don't need the other kid. You just need me and mine. And I am telling you, in real time, you can go look it up. The first time Munchausen by proxy was ever mentioned in this case was by Christie Blanchard in 2015 in the first Facebook group that I met her in. And that's where she had already gotten through several different people like me who had been screwed by her exactly like me. And that's how that team of people knew when it happened to me with Natasha that it had happened and that I had been screwed. And they came to me and they started talking to me. And then a tip came in just very recently to tipsforgoodwives@gmail.com showing me that in Megan Pack's thought catalog, it shows in real time that Christie actually did that. That it was being reported as a murder by, a boyfriend and girlfriend, that that it was fraud, all those different things. And the reason that Christie had that document, that specific document, before even HBO started working, before Michelle Dean wrote her BuzzFeed article, is because it was that document with Munchausen by proxy was 100% included in the fraud investigation from 2009 and 2011. So she had that document. She had the cabinet. She admits that she's the one who took all the medicine to Mike, and her and Mike, along with HBO, crafted a story and they floated it to the media, and it is 100% knowingly false.
Right. And so I want to, remind people that, Dee Dee is not the monster that she
No.
was portrayed to be. And remember, she was someone's daughter, she was someone's friend, she was someone's sister. And, she made mistakes, yes. Did she use the system and manipulate the system for her own financial gain? Absolutely 100%. But
100%.
Gypsy was in on it. But at the very beginning of Gypsy's life, she was just a concerned mom like the rest of us.
Her daughter had a lot of health problems that were unexplained. They didn't understand why. They knew from the very beginning, it's the first thing she told anybody. She has a chromosome disorder. Now, did she put her in a wheelchair and make her play it up? Absolutely. Did she fraud the government and all the charities and all of that? At some point, yeah. Do I think the charities at some point might have known? Yeah. It's why they haven't gone after her. She was making them tons and tons of millions and millions of dollars. They toted her out to every freaking thing before she got to Missouri. Then it just got more and more as she came to Missouri. Okay. So thank you guys for tuning in and dishing true crime with the Good Wives. Make sure to follow us on all of our socials at Good Wives Net. I am back over on TikTok under Spicy Red 92. That is just my personal account. If you'd like to follow me, I will be posting different things up and different things over there, but I will not be using TikTok as a main source of anything anymore. I have a Clapper going. I'm going to get Rumble going here this next week. But YouTube and Facebook are the main place for me to come and bring information to you. And like I said, this will all be included on the $30 level of the Patreon. You'll be able to see 3 different documents that span over 240 pages of information. It's all been redacted and it's ready to go. And we are hoping to use that money to fund our book and our documentary. Now, I did say there was going to be an announcement today.
Also, I wanted to add the Buy Me a Coffee.
Yes.
It's less than $2.
Yeah, you can do $1, you can do $5, you can do whatever.
Right, and that is something that is used to help in the investigations.
Right.
Buy me a case, because we do have to pay for these files.
Requests and things like that, so that helps us out. It helps us do what we do here. Okay, and so if you go over to patreon.com/goodwivesnet, that you can get the documents. I am putting them in there right now. And we're hoping that if, at least 100 of you go and grab that, then we will have enough to get started on the documentary. And here's a big deal. On April 1st, it is Christina's birthday. And so Colleen and I are working together to transcribe the first season of The Good Wife's Guide to True Crime. And we are using it as a companion piece to the podcast with additional bonus content inside of it and a sneak peek at our actual book that will be coming out later called It's All a Distraction, our 7-year journey investigating the life, the crimes, and the murder of Dee Dee Blanchard. It should be available on Amazon. We'll be announcing it, self-publishing it. I'm super excited. We have been working on this for a little while, and we're really, really excited about the things that we're going to bring to you. Christina and I and Colleen worked our asses off for 4 years to get this company to where we are, through a pandemic, through being sick, through loss of our friend's life, through being bullied, harassed, stalked, cyber stalked, all of this. We built a whole ass company that others tried to steal because they didn't want to do the work for the company that they were building originally. So we did. It's just been the 3 of us for many, many years. And now we're so thankful to have Sarah as an addition to our team. We have a couple other new additions to our team, and we're thankful for that. And I just have to say, you know, to every single person who's come through my door in the last 9 years working on the company, and the last 7 working on this case, you all brought pieces to the table. We all could have eaten at that table. You made choices not to be at the table. You have to own those choices now, because I sure as shit did. All right, guys, I'm going to let you guys go. Thank you for joining me this Sunday afternoon. Go check us out everywhere. Sorry about my little family in the background. But I think that this gives you a very comprehensive look at Gypsy's medical files without having to give you thousands of documents you don't understand and just random bullshit. It is all linked to this chromosome disorder. And you can see it in our Patreon. And you can see it on our documentary and our book that will be coming up. Thank you guys very much. Have a wonderful day. Thank you, Sarah, for being
You guys.
today.
No problems. Everyone stay safe. Have a wonderful day.
Bye.